I would expect, quite frankly, that the vaccines we currently have will show efficacy against severe disease and hospitalization. But we have to measure that, and we have to confirm that that's the case, and we also have to confirm if there's any loss in that protection. But I would expect to see some protection there, and that's why it's so important that that's the best weapon we have right now, is to get vaccinated. We know as the virus has taken that opportunity to evolve, and it is our belief that if we were distributing vaccines in a more equitable way, especially in high-risk populations, that we would be doing much more to avoid that. But the idea of, giving vaccine boosters to perfectly healthy younger adults who've already had 2 doses of vaccine, to the exclusion of vaccinating vulnerable people with a primary dose in low-income countries, that's when it becomes a real trade-off, where it becomes more unacceptable that that's happening. I would prefer if people take their national advice from their national authorities, that their national authorities offer them a booster dose of vaccine. Please go get your vaccines. But at the same time, write a letter to your government and say, share more vaccines, please. So be an advocate for sharing. But I'm not here, and neither is WHO, to stand between people and their national government's policies and priorities for vaccination. I would never discourage that, and we would never discourage that. And I think the pandemic and the impact of climate stress is really showing us that we're on the wrong path and we need to change. So I have real hope that something is going to change. But probably the biggest regret is January, the end of January, and the declaration of the public health emergency. I think we assumed that using the IHR and its, that sort of pulling that cord, the emergency cord of saying this is a global public health emergency, would have stimulated the world into action, and that didn't happen as much as we thought. And it's a regret of mine that we underestimated the lack of response at that time.